Steve Hodges, who was somebody I hadn't previously met, sent me a note and said he'd like to come talk to me about the healthcare applications of SenseCam. So he walks into my room, he's wearing the SenseCam, and he's talking to me. Then he goes over to my PC and he plugs it in and shows me the conversation that we just had. And I was convinced immediately that this was exactly something that we should pursue. And he started telling me, well, we'd like to do some clinical trials, we have some anecdotal data, but we really want to be able to do some true experimental analysis of the value of it. And no question in my mind, that was something that we needed to invest in right away. And we said, who's the best of the best? And those are the people that we then contacted to perform the different types of experimental analysis. And we had them submit proposals. We didn't fund every single one of them. What we did is we just funded the top of the top and got I would say the best range of people actually to perform the experiments. So that would have the best result. What we want is really a high level of credibility in the results that we're coming up with. So by funding the best, there's just no question about the viability of the actual experiments that we're conducting. What we're doing is we're actually looking at different types of sensors and miniaturization of sensors. Things like being able to monitor your blood glucose as well, so building that in. So people who are diabetic, for instance. So it opens up a whole range of different types of sensor capabilities that we can actually include in with the SenseCam type technologies. One of the biggest problems that we face as a culture is a growing older population. There are more and more people that are living longer and longer. And what would be nice is for those people to remain more autonomous. So giving them tools like SenseCam that actually maybe enhances their memory or even enables them to become more autonomous for longer periods of time is a real advantage. So this has actually had a galvanizing effect in the research community to be able to move in a new direction of research. It's a very nascent field, this assisted cognition. It's very new and it's very interesting, and I think it has long-term ramifications. Because if you think about what SenseCam is today, we're studying it for cognitive disorders. But imagine that everybody wants to have perfect recall. Along this line, it's not just going to be able to help people who are cognitively impaired, but it opens a whole new science into how do we, as individuals, as humans, actually become even more enhanced through tools like SenseCam.